This is Jerry Hesch of the Hesch Institute, and we are interviewing Mom. So if you could just tell us your story, please.
Hi, my name is Helen. I am the mother of Abby. She is a medical student in Mississippi, and she was injured in April. And my husband and I brought her home to help take care of her and to get her better, more advanced care than what she was getting. And it's been a long journey. She has had a tremendous amount of pain. She has undergone a lot of depression. So we have encouraged her to seek any care that she thinks that she needed during this journey. And during her research, she discovered Jerry at the Hesch Institute, and she admired his model of care that he provided his clients, and investigated all she could, and we ended up here in Nevada. And we have truly, truly been amazed at the way Jerry approaches a patient as a whole person, not just the site of injury. And he has just proven that he works miracles in his own way. It's just amazing to see the transformation the past 72 hours of my daughter, and the education he's taught her is invaluable. And we hope that everybody seeks the type of care that Jerry can provide. Very gentle, very informative, and he has given her hope again, and that is more than any mother could wish for.
When you say, miracle worker, it's an intimidating language. It's, what do you mean by that?
By that I mean you focused on more than just what her injury was that brought her here. And she was able to relax in your presence within the first hour or two. She trusted you. She's never had that relationship established with any other physician that she has seen during this injury. Most of them wanted to do continual pain provocation tests after already knowing where she was injured. That did not help her recover in any fashion or form. So when you're able to approach it in a gentle fashion, in a very systematic fashion, that gave her trust in you as a therapist. And she was able to envelop that and just basically wrap her head around the fact that she is going to get better because someone has paid attention to her. Someone has listened to her. For the first time in these several months, she's had someone listen to her and validate what she was saying all along. And that is what I would consider a miracle worker, someone who just took the time to listen to her.
And beyond listening, there's the thing about listening to her body, to finding out what is going on with the body. And you talked about that we didn't just focus on where the injury is, where the pain is at the sacroiliac joint. She had a sacral thrust done. That was the source of the injury. But we treated other things. Can you comment on the other things that we treated, that we found that maybe you didn't anticipate?
The fact that she had the glide that you called in her femoral.
In the knee. You're talking about the knee joint.
The knee. Okay. I'm sorry.
That's okay.
We heard a lot from you this weekend. I'm just amazed at the data. But the fact that we never really observed her having any issues with her gait on the right side. I just thought it was just her unique way of walking. But the fact that her knee and her foot are unique to her, somebody else would have said, oh, we need to fix that. And for her, it's normal. And so I appreciate that. I appreciate your antenna going up when I commented about this coloration in her circulation in her legs and the temperature change in her knees. That's not ever been noted in her other appointments.
And we looked at her hip. We did some stuff with her hip.
Oh, the hip was investigatable.
The true hip joint.
Okay.
The one by the front pocket. The top of the thigh bone.
Mm-hmm.
And we did work on the injury itself.
You did.
We did get to the injury itself, but we had to treat much more than that.
How was the description? The ilium?
Yeah.
Okay.
Side bent ilium.
Side bent ilium. That was a total surprise to me to hear that you diagnosed that.
Yeah, it's a pattern I discovered. It's not in the literature.
Okay.
But for her, it was an important pattern.
Mm-hmm. Well, Well, I just think there was just so many, like you said, the dots were not connected at all, and they have now been connected.
Very good. Thank you. You toned down that word miracle. It was intimidating to me, but you clarified that it meant listening to the patient, letting them tell your story, and let their body reveal itself to the practitioner. Hope I'm not putting words in your mouth,
No,
but
that's
and that injuries can be more complex than just where it hurts. Is that right?
correct.
Good.
Correct.
So just summarize it up. How do you feel now?
Oh, I am just in awe of your skills. I am just in awe that she now has hope that she is going to go back to school. Because up until now she's used the word if a lot,
If
and now
when.
she's saying when.
Yeah, yeah.
And that's a huge thing that that you have to have hope in your life. And so I think that you've done an excellent job in helping.
And that's what her body tells me. That's her body is telling me that it's recovering and it likes what we're doing with it, what we did with it, and I base my optimism on that.
Well, we appreciate it, Jerry.
Sure. Thank you.